And so, Maggie,
Mm-hmm.
what's been the most challenging part for you as a therapist?
I would say recently, in the past 2 years, with the pandemic, of course, I think what I've noticed is overall just the level of how the pandemic has affected people, right? Those who were able to manage and had decent coping skills, right? Now I'm seeing clients that it truly has affected them, and they're not in a space where they're no longer able to manage a lot of the feelings, a lot of the mental health issues. So just seeing the level of pain that people are in right now has been very difficult, and that's been a little bit of a shift.
Yeah, that I think every therapist I know is looking out, so far, because we have so many people who need the services.
Absolutely.
and those folks who were kind of just like you're saying, Maggie, who were able, they were coping, right? Maybe not, they weren't necessarily where they healthy, but they were coping, and that was getting them by, and this just kind of cut them off at the knees.
Yes.
And so that it is really, really hard because people are struggling. Yeah, in a way that we haven't seen before.
Absolutely.
Yeah. And how about for you, Becky? What's been the most challenging part of being a therapist for you?
The most challenging part of being a therapist to me, I feel, is barriers to care, especially with the work that I do, the area that I service. Not everybody has internet, not everybody has insurance, not everybody has means, not everybody puts value into mental health. So having barriers to care, they can't continue therapy, or their insurance, denials, or just different factors that come into play, and not enough resources, not enough therapists out there to absorb the need. So that's been really challenging. And having somebody call and wanting to work with you, and you're booking out 3 months from now, and all your colleagues are also booking out that far. There's just not enough of us to meet the need.
Yeah. Yeah, I and maybe you can answer this, Angela. I know there are a shortage of LCSWs. And so, I'm increasingly meeting more and more LPCs, but it just doesn't feel like we're able to meet the demand. And that, I think, for everybody's been challenging. We keep hearing about it in terms of medicine and how doctors are overloaded with, pandemic patients, who are dealing with COVID, but not only their regular patients who can't get in because of COVID. And then there's this shortage of nurses. But there's also the same thing is happening with therapists. There are just not enough of us to go around to service all the needs. And so it's really challenging when there are those barriers there, either with insurance. That's really tough, and it can be heartbreaking.
Very.
Somebody's in crisis in that moment, you're saying, I'm so sorry, I can't see you for 3 months, and it's just and so people, I think, get hopeless sometimes, and we don't even have the numbers on how many people just decide to not pursue therapy because they can't get in with the therapist.
Right.
Yeah. And so I want to go back to you again, Maggie.
Sure.
What is a misconception about therapy that you'd like to clear up?
I think the big one for me is going to be that only those who are in dark places, or who are suicidal, or who have these extreme mental health disorders should be seeking out therapy. And that is the farthest from the truth, right? And I think that's probably the biggest for me, right?
Yeah, that makes sense. People hear, I'm not crazy. I'm just doing just fine, And so people don't realize, oftentimes to put my clients at ease, I'll say I'm just a thought partner for you.
Absolutely.
Right. And we just kind of talk through things together. We walk through it together. And that helps you come to some decisions. It gives you some, illumination about your own life and the way you may be showing up. And so you can use therapy in order to even have more of the good things. Absolutely. It's not just always the challenges. So it can be very, very beneficial. There are very few moments that we have in life where we can spend 50 minutes just talking about ourselves in various aspects of our lives. Because most of us are running here and there, trying to get things done. So it's like this quiet space that you get to talk about yourself. So yeah, that is a huge, huge misconception. So those of you know, you do not have to be in crisis in order to seek the services of a therapist. How about for you, Becky?
I like what you said. We are a thought partner, because a lot of times people in my work and my experience are afraid of therapy because they're afraid that I'm going to be telling them how I think they should live their life and the choices they should make. And I'm just a partner. I'm a listening ear, bouncing ideas off, and you make the choice. You make the decision of the changes, and you know what choice is right for you. So that's a huge misconception that we are the ones making decisions or thinking that they should live a certain way or make different choices. But no.
Right. We're supposed to have a non-judgmental space. It's interesting because we're sitting with our clients and we're not at all telling them what to do. It's really, we're just kind of reflecting back and helping them come to some of those conclusions themselves. I often tell my clients just to give them a sense of control. I tell them that I work for you. And so that they feel like they're empowered. And so I say things like, if you feel like, therapy isn't moving the way you thought it would or as fast, let's talk that through, so we can set different expectations, etc. But to give them a sense that they're fully in control of that space that we're in together.
I also share with my clients that they're the expert in their own lives. Right?
Yeah.
Yes.
Right? Because we see them once a week at the most for an hour, right? They still have so many hours outside of that office. In therapeutic hour.
50 minutes.
50 minutes. So, this is your journey. I'm just walking that path with you, alongside you. Absolutely.
Yeah. Yes. What about for you, Angela? What's the biggest, kind of misconception that you,
feels like a misconception, also maybe like a false expectation I've experienced. I think with a community that I serve in particular, so I'm Latina, so I serve the Latinx, Latino, Hispanic community. And it's that, I tried that therapy thing and it didn't work. And so if you finally get over the first misconception of that's for the crazy people, or for the really sick people, and you try it, and it doesn't work. And so then you stop. And so the idea of, similar of what I think we were just talking about is that if it's not working, you can ask us, that we are your partners, that we are here with you, that we're not the experts in your life, that we are experts at what we do, but when it comes to partnering with you and being your therapist and walking that journey with you, it's about what's going to work for you. And so that, I think a lot of times clients get hung up and they're like, well, you're the therapist, you're the guru. I'm just like a human living life too. I have all these training and the skill set that I bring to the table, but you can ask questions. You can say things like, why is this not working? Or is this the way it's supposed to work? Or tell me, a lot of times friends or friends of friends will ask me, like, what should I look for in a therapist? And I often say, well, ask them about their training, ask them about their theoretical approach, their life perspective. What we know about therapy today is that what works in therapy at the core is when you make a good connection with your therapist. Across all the studies, across all the,
that is true.
Whatever, CBT, EMDR, DBT, whatever, evidence, it's, do you feel connected to your therapist? And that's going to help you. And so
that's the best predictor of good outcomes for clients. And people always think it's the modalities are they're tools within the toolkit.
Right.
But if you don't have this, then it just doesn't work.
That human connection.
Yeah.
Absolutely.